Hello, my name is Dr. Celeste Reese. I'm a board-certified family medicine physician specializing in urgent care. Today, I'm so excited that you guys are tuning in to learn more about how you can examine your family cancer history. When we think about the term family cancer history, what does that mean? Who does that mean in terms of who we need to talk to or what information that we need? Glad that you asked. I'm going to share it with you now. The first question is who? Who are you going to ask? Let's start with your parents. When you talk with your parents about their cancer history, you want to know if they've had a history of cancer, but you not only want to ask your parents, you also want to ask about their parents, your grandparents, and we want to do this on both sides, the maternal and paternal side. In addition to that, you're going to ask about their siblings, your aunts and your uncles, and even ask your cousins. You may be asking now, what exactly am I going to ask my parents? So in finding that detailed family cancer history, don't skip over your general medical history as well. Whether or not people have diabetes, heart disease, or obesity impacts whether or not these people are at increased risk for developing cancer. So you want to find out that complete medical history, but you're going to ask your parents, hey, is there anyone in our family who has a history of cancer? You want to know also the ages at which these individuals may have been diagnosed with cancer, whether or not they were able to receive treatment and they lived, or that they passed as a result of the cancer. Knowing the age at which that particular family member developed cancer is so important in helping us to decide at what age should you start screening for that particular kind of cancer. There are different cancers that typically are diagnosed at different ages, but for certain cancers, if they're diagnosed at a younger age, we start the screening at a younger age. So we're going to ask our parents. You're going to ask your grandparents, both your maternal and your paternal grandparents. You're also going to ask aunts and uncles on both sides, as well as cousins. If you do have siblings, you want to also know if they've had any form of cancer. Once you have this cancer family history, you're going to go to your primary care physician, have and visit with them, get routine blood work, and discuss with them, hey, I have family history of these kinds of cancers at these ages. What do I need to do now? When do I need to be screened for these varying forms of cancer? So your next question is, what kind of cancer should I be asking about? Well, there's several different kinds of cancers, but there's certain kinds of cancers that are more common in certain ethnic populations. So the ones that we're going to cover with you are ones that are more pertinent to the African American community. The first is going to be breast cancer. It is being diagnosed at younger and younger ages. In addition to that, prostate cancer, which is also a hormonal form of cancer found in men that is being diagnosed at younger ages. There's cervical cancer, colon cancer, as well as testicular cancer. We're going to make sure that we cover in these sessions what you need to know about appropriate screenings of all these forms of cancers. So you may ask, well, what is considered to be a pertinent family history of cancer? Whenever you have at least 2 relatives in one particular kind of cancer diagnosis, that is considered increased risk of that form of cancer in your family. So when your parent tells you, well, we have family history of breast cancer, so you're going to ask, okay, mom or dad, who is that in? It was in your aunt at age 43 years old. So you're going to want to know about your aunt a couple of things. We're going to want to know, what were her medical diagnoses at the time? Did she have a history of high blood pressure, diabetes, heart disease? You're also going to want to know, how old was my aunt when she was diagnosed? Is my aunt still living now? Has she preceded us in death already? So we want to know the age at diagnosis, we want to know the age at death, and we want to make sure that we are sure of the cause of death if it was a result of this form of cancer. This information is very pertinent in helping us to decide, do we need to screen this person at an earlier age? We are finding that we're screening African American young ladies at earlier ages because there's a form of breast cancer that is more prominent at a younger age. That's just one example. We'll go into more detail in our next session. So join us for our next session, which will be race, gender, and cancer. Thank you. We hope that this session has been very helpful for you, but we don't want you to forget that we have a 6th session called Ask Dr. Celeste, where you can ask any questions that you have about any of the information that we've presented. So don't forget to tune into our 6th session. Thank you.